Hi friends, I have the honor to introduce to you Dr. Sriral TV. He is ranked 16 PGI Chandigarh May
Sir.
2018.
Sir.
It's an awesome rank, great performance,
Thank you.
heartiest congratulations.
Thank you, sir.
So how are you feeling today?
Sir, I'm feeling really excited about this rank. Sir, the past 6 months were really hectic, and now that I'm done with it, I'm feeling very relaxed and excited that I got such a good rank.
It's very good.
Thank
So you joined us for the 6 month that we started the AIMS TND batch, AIMS test and discussion batch, fast
Yes.
track. So how was your experience with the test and discussion?
So it was a good experience. Like after the November exam, I did not know how to proceed further after that exam. So once I got to know about the fast track T&D batch, I think I thought that this was the opportunity for me. Like there were the 2 classes per week, and I was able to complete my syllabus only because of the T&D batch that was going on, the fast track T&D batch. Like before every exam, I tried my level best to complete that particular syllabus and give the exam to the best of my abilities. And this really helped me because it gave me confidence when I was doing well in the exams, that I was completing the syllabus and I was doing exactly as per the schedule. So this really helped me to complete the syllabus on time.
So I think the reason we had kept this fast track TND with 2 tests per week is because we wanted you to go faster because the time is less. So when you are preparing for a mid-year exam, we are not preparing for the longer game. We
Yes,
have
sir.
to finish in 4 months,
6
revise,
months. Yes, sir.
and then give the AIMS and PGI exam. Otherwise, the superlative ranks would not have happened. That's
Yes, sir.
like, so speed is the key in the mid-year exam is what
Yes,
I
sir.
feel.
Yes.
So, how was your experience with the kind of test papers that we had created with the TND batch, and
Yes, sir.
how was your experience with the discussions? What was your experience with the teachers?
So the discussions were really nice. Most of the subjects I felt that the discussion was up to the mark. Only those topics which were required for the exams were being taught in the test, and the questions were really of I think it was more better standard than the AIMS questions that really came. So we could prepare really well with the questions that we had. And most of the faculties, the notes which the faculty gave, the notes I made from those lectures only helped me revise to better than I expected. I could revise only because of those notes. And also the many subjects like pathology and all, I was feeling a little bit weak because of after the November exams. But due to this test and discussion, I could prepare them well. The questions that came were almost of the same pattern that came in the AIMS exam.
Did you utilize the AIMS discussion that we had done before
sir.
the mid-year exams? How was your experience with that?
Yes, sir. Sir, I had attended the AIMS discussion for 2 days. I had attended almost all the classes. So the topics that were discussed, like the faculty, they know better than us what topics are being asked. They know what to expect from the AIMS paper. And after I attended those lectures, it was easy for me to revise all the topics within those given 2 days. And also those topics which they mentioned only I had stressed upon during that the coming 1 month after the discussion was over. And that also really helped me for PGI exam also. The discussion I had attended, and it was really helpful.
Okay, and did you utilize the e-learning ventures that we have, like the e-medicos and the grand test with video discussions?
Yes, sir.
What was your experience with those?
Sir, I did not know about these facilities at first when I joined DAMS, but later on the faculties kept mentioning about these things, about DAMS Cloud, about the ebook test series. Then when I started using those apps, it was really saving my time, because earlier I used to have difficulty in managing my time. Like after I came back from the my duty, it was I was finding it difficult to start studying. And also when I started taking breaks, my breaks used to extend for a long period. But after I started using these apps, whenever I was taking a break from the regular studies, I used to look in the series app or the e-medicos app. I used to look in them just to see the discussion what was going on, and that saved a lot of time for me. That was a sort of revision also, because the entire schedule was being discussed. So that was also a revision and also a serious time managing app for me.
Did you utilize the Facebook group as well, or were
Yes,
you a
sir.
part? Yes. So
Yes,
how
sir.
was your experience with the Facebook group?
I used to follow almost all the discussion that was going on. Not all the posts, obviously, but most of the posts by the faculties I used to see. The pathology, the pathology posts which came in that group really helped me to understand the concepts, and the videos also being posted were really nice. I could clear my concepts within a day or two. and the videos being posted after the grand test also were really helpful. I started doing grand test only after the March, but all those grand tests I did, I tried to see the videos that were being posted of the answers, and this like within a few 2-3 hours we can revise almost the entire subjects, and there is an option for us to also like watch it in double speed or triple speed. So those concepts which I knew once, I used to like keep it in a fast way, so that I was able to do it more quickly.
Perfect. So I also want to know from you is that like any particular teacher that you want to mention today that when we were attending the classes, and anybody who you remember today?
Yes sir, I really like the classes by Surya sir, microbiology. Like he was
way of teaching is very dynamic.
Yes sir. So he used to show us videos about the topics being discussed, and like we could attend all his classes like 100%. Like we could attend the classes, and also Diksha ma'am, she was really nice, and also sir the Sakshi ma'am, her classes were also brilliant. So like these names just at the top of my head, but almost all classes were really brilliant.
It's a very great pleasure to talk to you today, and I see that you've done well in both AIIMS and PGI exam. So can you help the future aspirants by highlighting the differences in strategy when you're preparing for both?
Yes, sir.
Like if somebody is preparing for AIIMS, what should he do if he's preparing for November AIIMS, November PGI? What is your take on it?
Sir, I think if you're focusing like both of these tests, they basically see how much knowledge we have, how much thorough are we with the theory portion. With AIIMS, it is more of a concept-based exam. Like you should know all those concepts you are learning. You should be thorough with it. Like for AIIMS also, there is an option for eliminating the options. So intelligent guess you can do in the AIIMS exam. But for PGI, it is more like the negative weightage is a little bit higher than the AIIMS.
Difficult to guess.
Yes, sir.
That is the entire purpose of PGI exam, is more than one answer with negative marking. So you guess, you might be penalized actually.
Yes, sir.
So that is where you go little safer when you are playing the PGI exam, and when you are in the AIIMS, you go more aggressive.
Yes, sir.
Yes.
So in PGI exam, like I marked only those answers which I was like almost 100% sure that this was the answer. But in AIIMS exam, like I made a lot of guesses, and like some of them.
How many did you attempt in both the exams?
Sir, PGI attempted almost like I marked almost 500 to 600 options, and in AIIMS exam I had marked 182. Sir, I compared to the November AIIMS last time, the AIIMS exam this time was a little bit the pattern was little different, because the questions were like usually in AIIMS only the general surgery portion is asked. This time a little bit in depth they had asked. So like and also there was a little bit problem in managing the time in AIIMS exam. But that is why I could not mark more options. So, but in PGI I had done my level best to attempt almost all the questions, but only those answers which I was sure I had marked.
Any other changes that you would like to highlight that which you felt were in AIIMS different from the pattern that was being followed in the last 2 years and this year AIIMS? One, that they put a little bit more deeper into systemic surgery. Anything else you want to highlight for future aspirant?
Sir, also the fact that AIIMS had started to like usually they ask only about 20-30 difficult questions. But this time they had got little more in depth into those topics which were earlier being asked, and also the topics that they are also focusing on newer drugs and newer concepts that are being coming up, and so I like earlier they did not ask this much about the newer drugs being.
That was usually more in JIPMAR and the exams. This time even in AIIMS they have used the
newer drugs.
So I think these are valuable insight for future aspirants who's wanting to learn, and they want to learn from the person who's done well in both the exam, and so that somebody can guide them. So any particular topics that you feel were more asked in PGI exam for future aspirant? PGI, like we talked about AIIMS, like for PGI.
Yes, sir. Sir, like PGI, I think it is essential to do 2 or 3 previous year papers of PGI, because there were many repeat questions in PGI that were directly from the previous papers itself. So like it would be better to go in depth into the previous papers, because the options they might change 2 or 3 options, but the topic is almost exactly the same as the previous year. So which topics you are reading in the previous year paper, try to go a little more in depth about those topics and give stress to those topics mainly. And the theory, like throughout the 5-year MBBS, whatever you are learning, like almost all the topics are being asked in the PG exam.
My personal understanding is when they're giving a PGI exam and you're doing 250 questions, 5 choices each, they kind of cover everything.
Yes, sir.
There's nothing like which is left behind.
Yes,
You have to know your MBBS, otherwise you're
sir.
struggling.
Yes,
And second, what I've understood in the PGI exam is that they have that idea of favorite topics. So
Yes,
if you do last 3-year papers, you
Yes.
get that favorite topics hang.
Definitely.
While in AIMS, they sometimes will hit you unpredictable.
Yes, sir.
You just see the favorite topics, but they will put some new topics
Yes,
every
sir,
time.
definitely,
That is the
Yes.
difference between the two central exams.
Yes.
In the end, both of them are central institutes. Both of them are the apex institutes in the country, and these are the institutes which people dream about when they want to do their post graduation.
Yes,
and
sir.
now you have a chance to do it in one of them, and I'm very proud of you.
Thank
and
you.
I'm sure you'll make a great physician, or whatever branch you would take, you'll
Thank you.
do a great job in it.
Thank you.
Now I want to put you in a hot seat to finish the interview. I want you to say something motivating to future aspirants.
Sir, I would like to mention one of the members of the Dams Exclusive Club, Revati Benjamin.
Yeah.
Sir, I saw most of her posts. It was really motivating to see her posts and just to read them. I think it is most important not to lose confidence, because we might miss 1 or 2 days in between while we are preparing for the exams. But if you have confidence in yourself, and if you know that you can make up for those lost 2 days, you will be easily able to cover all the subjects in the given time. And it is important just to keep calm and just try to for the next time. If you didn't get this time, it is important to have confidence in yourself. That is the most important thing.
With that note, we have now he has given us insights on the detail of the pattern, the subtle changes in the pattern that have happened this year, and he's also talked about the value of keeping your confidence up despite having 1 or 2 days in between you will be feeling down. But great messages from him, from a great boy. I'm sure he'll do well in life. From the entire Dams family, I wish him all the best, and I take this opportunity to congratulate your parents as well for this splendid achievement. Heartiest
Thanks.
congratulations.
Thank you, sir.
Congratulations.